Welcome to Girl Talk with Dr. Bajaj and myself, Connie. I am her patient consultant at Bajaj Plastic Surgery. Here's a topic that I want to tackle. It's the explant topic. We have a lot of patients or just a lot of women right now in this time frame that we're living in where people are wanting their implants removed. They got them for a reason, right? Like, I think that the woman who gets breast implants is the woman who decided that she was unhappy with her silhouette, her contour, decided to get some more fullness so that she would feel more confident, have that silhouette. And now somewhere along the journey, it changed, right? Maybe she's more into going natural, and you call them the granola, right? It's that whole granola movement. Let's get all the foreign objects out of our bodies.
Yeah.
Let's live naturally. Let's do the yoga and meditate. And so let's get our implants out. Well, my first question, I'm like, you got them for a reason. So it's going to be very shocking. This is going to be a hard thing to kind of grasp what you're going to look like without them.
Well, there's no way to predict what you're going to look like without the implants, particularly if years have passed. I mean, you got your implants in your 20s, your tissues were different, your skin was tight. The ligaments, known as the Cooper's ligaments in your breasts were nice and tight, and you probably hadn't had kids.
Yeah.
Or maybe if you had, you still had good quality skin and ligaments.
Right.
And
so I can't just look back at the picture and go, okay, I'll just take my implants out and I'll look like this again.
No, I think that's completely not going to be real.
Right. And your skin has been stretched to hit that 350 cc implant or whatever that
Well,
is.
your skin's been stretched, but also let's just get real. Once you hit perimenopause, which starts to happen in your 40s, your skin loses collagen and elastin like that. And it's cruel because women lose it faster than men. And that means your skin sags.
I say every year of my 40s has felt like a decade from before, or maybe 5 years or something. It's just things happen so rapidly with losing elasticity and losing collagen.
It's like one day you feel like you're old. I mean, seriously, like I was doing planks in my home gym one day, and I looked at my thighs, and I was like, what the hell happened to my skin?
I know. I know. Yeah, just don't look. The planks are good. Keep doing that. But I'm telling you, don't look. So explants. So we're getting these questions. What can we do as you being the board certified plastic surgeon that you are? What resources do we have to offer these women who say, I want them out regardless of their reason? What resources can we offer versus just going?
Well, so when you're getting your implants removed, if your body has changed, a lot of patients who come in their 40s, 50s, or 60s and want their implants removed, one of the reasons they want them removed is they've gained weight, and now their larger breasts make them look a little bit heavier. So a lot of these women still have plenty of breast tissue now that they may not have had when they were in their 20s because their bodies have changed. So for some of them, just taking them out and maybe doing a lift to help reshape the breast gives them a really nice, pretty, proportional breast. So I think that's a really good option for a lot of women as well. Other women, if they're really concerned about losing some of that fullness in the upper pole, we can do some fat grafting at the same time, which helps. It's not the same as an implant, but it just softens things up and gives a little bit of a nice contour.
So I think that's what I would need to do. If I ever had to get to that point in my life where I was like, okay, these got to come out, but because before I got my implants, it was like rib cage, it was the skin, and I had you could see shadows where you could see my rib cage. You can still see my rib cage. But it's nice to soften it. Is it going to give you a cup size? Is it going to give you, what are the expectations for a patient?
I don't think fat grafting is going to give you a significant increase in cup size. I mainly think it gives you a softening of contour. And sometimes I think it helps with skin quality. I'm not 100% sure about that, but I think it might. But I do think that even if we do an explant and we do a lift, women have to remember your breasts are not going to look like what they did when you were 20 because life has happened. In that intervening 20 or 30 years, your body has undergone a significant change. And that's hormonal, and that's aging, and that could be other life events such as pregnancy, weight loss, weight gain. And so everything's going to be different. And so I think the most important thing to understand is you're not going to walk out of there with your 20-year-old boobs.
Right. So it's only like, what can we do from this point forward? Try not to focus on what it was before, focus on what's possible from this point. And so you mentioned the fat grafting, fat transfer. Tell me a little bit about who's a good candidate for that and what your kind of principles are surrounding that topic.
So with fat grafting, what we're doing is we're doing liposuction somewhere. Your outer thighs usually, because that seems to be a place that has some fat that sometimes women don't want. And we process it or wash it and clean the fat, and then we inject it in thin layers. And so when we're injecting it, we're injecting that fat, and it's going to get a blood supply from the surrounding tissues. So you inject it in thin layers. And so what that means is you can't just inject huge clumps of fat. Because if you inject huge clumps of fat, it's all going to die and turn into an oil cyst or something gross. So you inject it in fine layers. So that means, for me, if I'm doing an explant, I inject maybe 100, maybe 150 cc's of fat to cover the surface area of the breast. So that's not going to be the same thing. It's not going to give you the same volume as taking out a 300 cc implant.
Right.
It's just softening the effects to give you a little bit more fullness along the top part of your breast. The other thing to remember is since that fat is a parasite, it's going to get the blood supply from the tissues that surround it. Not all of it's going to live. And typically, I would say 50 to 70% of it lives and the rest of it dies and gets absorbed by your body. So it's never going to be the same thing as an implant, but I think it's a good option.
Especially if you're already a good liposuction candidate.
Right. If you've got
ooh.
the fat and we can do the liposuction and use the fat, it's a great option. And you have to have realistic expectations about what it's going to accomplish.
Right. But then what if they don't have that fat? Because remember, we're talking about these yoga granola girls. What if they're so lean already and they don't have it?
Well, there are other options that we have available today for women who don't have any donor sites or fat. And one of them is aloclay, which is cadaveric fat that's harvested. One thing to remember
from a
is
cadaver.
that it's going to be the same issues. Like we don't know how much of it's going to take or how long it's going to last. The other thing is to be honest, it's not significantly cheaper than doing surgery.
Yeah.
Which is another thing that I think ends up being a little bit of a roadblock to using aloclay.
It has a price tag for sure, but you're not having that aggressive liposuction surgery. So that's a plus. And if you don't have it, then that's good. But it's also, it is cadaver fat, but it's gone through a lab to do, so it becomes, or they're saying it is more predictable than the patient's own fat.
That's what they're saying. I don't have a significant amount of experience with aloclay because most of my patients are very resistant to the price tag associated with it. So
it's like a liquid gold in a syringe. Just you're going, but at least it's out there and it has those kind of restorative properties that they're talking about, kind of giving that rejuvenative, right? Isn't that some of that? Do you know what I'm talking about?
So there's a lot
I read the pamphlet.
You read the pamphlet. So there's a lot of talk about how fat can have regenerative properties. And that's why we're seeing a lot more use of nanofat, for example. And nanofat is when we harvest the fat and process it out so it's basically emulsified, but it preserves all the good cells like the stem cells and stuff like that in the fat. And then you can inject it into your face or use it with microneedling, and it's supposed to improve your skin quality and skin contour. So there is a whole other field out there, I guess, where people are exploring the regenerative properties of fat.
Right. Yeah. The good fat.
Yes. But that's still a process, a learning. That's something that we're still learning about.
Yeah. So aloclay, using cadaver fat. Sometimes I think about that. I'm like, ooh, I don't know if I want dead people in me. But they have good marketing. They make it look pretty. So I'm kind of getting closer to being on board with that. What about the auto-aug? I feel like you kind of talked about it, but not who is a good, do you know ahead of time if someone's a good auto-aug candidate before you take their implants out?
Yes.
Okay.
So when we refer to the term auto-aug or auto-augmentation, what we're talking about is using some of your own tissue to help and manipulating it to help give you a smooth contour along the top part of your breast. And there are different ways to do it. So, for example, for somebody who's lost a lot of weight or somebody who has a lot of side boob, there's a lot of ways in which you can preserve that tissue that forms the skin and fat along your side boob and leave it on a pedicle and rotate it up towards the breast to give you shape and volume to your breast. Another way to do it is when you're doing a mastopexy or breast lift, you can use some of the tissue along the bottom or inferior aspect of the breast and advance it superiorly towards the top to give some fullness at the top. So an auto-aug is just a technique that refers to the way in which we manipulate the breast tissue to try to enhance the superior pole of the breast.
But you have to have breast tissue.
Yeah, you do have to have breast tissue.
So someone like yourself, who's very lean and tiny and all implant, would you be an auto-aug candidate?
No, I wouldn't. I think I would just have skin on top if I had my implants removed. But I don't know. I mean, that's what it feels like.
Yeah. So how do we set realistic expectations for a patient? What's the best way for us to guide them to not be so disappointed after surgery?
I think when a patient sees a plastic surgeon in consultation, she needs to discuss what she wants and be realistic when the surgeon who evaluates her gives her recommendations, right? Because what works for you may not work for your friend, or may not be what they're talking about in the Facebook group today.
Right.
And so I think it's really important that you have an individualized conversation with your surgeon to discuss what's realistic for you.
Mm-hmm. So it's good to go in with some research. Like, okay, I've listened to this cool podcast with this really cool surgeon and her friend, and now I have an idea, but stay open, stay flexible, because when you're in the chair and it's your body, it's going to get a lot more specific and customized.
Exactly. I mean, I don't think you can take the same thing and apply it to everybody, because we're human. Each one of us is different, and that's what you have to embrace.
Yeah, I agree. Well, that's Explant expectations for you. Thank you for listening to Girl Talk with Dr. Bajaj and Connie, myself, where confidence looks good on everyone.
So it's a good day to have a great day, and we'll see you
next time.